What recommendations do you have regarding lab cases and any further disinfection protocols in dental offices that you should follow? Well, I think getting back to the basics on that would be standard precautions. How are you currently managing the infection control for your lab cases, both going out and coming back in? Would be the same as long as if a disinfectant is used, you go on the EPA website, antimicrobial pesticides, you look up the disinfectant you're currently using and to see if it does have a coronavirus kill. And in terms of general disinfection protocols, again, follow standard precautions.
I agree, Kathy, and I think that with the current restrictions on elective dental treatment, you should have minimal lab cases coming in and going out, but there may be a need to, cement a crown or other prosthetic for a patient whose temporary has been lost or broken and who needs to have that treatment completed. And then again, as Kathy said, just follow your routine procedures for disinfection. There's really no evidence that COVID-19 is transmitted via environmental surfaces, but we have a lack of information to tell us for sure. But we do know that it can be killed through the disinfection process. So handling cases that have not been decontaminated yet with gloves and then using a disinfectant for the appropriate amount of time after first cleaning any debris should continue to be done and should be done even after all of this is over.
Absolutely. I think this time has brought us to reflect on what we're routinely doing and what we should routinely be doing, and probably giving more thought going forward in terms of how we're evaluating our infection prevention and control programs to assure we are following appropriate CDC guidance and recommendations.
I agree. And again, I know we've said it before, but I think, accessing this reliable information by going to the ADA website, go to the CDC website, go to the OSAP website. There's not going to be information on those sites that isn't from a reliable source and isn't evidence and scientifically based. And I think that is the best thing that we can do to reassure ourselves that we're doing everything we can to protect ourselves, our families, our colleagues, our patients, not just now, but always.
I wholeheartedly agree.